Hello, morning. This is Dr. Meg Stevens speaking, and our purpose today is for me to go over the course study for our Canadian chiropractors and their staff who are participating and helping and recruiting our adolescent participants to the course study in our Canadian cohort. So as you already would know, if you're at this stage, we want to be able to answer some big questions related to spinal pain in adolescents and what the burden of spinal pain is on adolescents, as well as what does that mean for them long term. But to be able to do that, we need to test out our study design, and that's the phase we're in right now. So we're trying to recruit 45 adolescent participants across Canada. We can use as many chiros as we need to get that number. And this is what we're gonna do. So once you have signed the chiropractic information consent form, then I'm able to put your name on the adolescent's consent form and they choose you as their chiropractor, so we know who to send correct um, all of the correct questionnaires to. And this is an important step. If you have multiple practitioners in your office participating, each one will need to sign this consent form so that those can be sent appropriately. It is still okay if, like in my office, if you will treat each other's patients if the schedule doesn't work or you're away, that's totally okay. But there's still going to be one chiropractor who is responsible for making sure that the questionnaires or the reports are getting finished. So here's our ask, here's your responsibilities basically. From our chiropractors, we're asking that you screen and invite eligible adolescent participants. And then you have a baseline and a final report. That's really all you get to do. And the rest, you just care for your patients as you would normally. For our patients, they have, of course, a consent form to sign as well. And then a baseline questionnaire, 11 weekly quick short text questionnaires, and then an exit questionnaire. So that can be really handy when you're going over with your participants. We'll go into that in more detail here in a second. So the study flow here. Step one is screening your adolescent patients. Sorry. And screening our adolescent patients is a really important step. It should become really quick and routine for you to do in your office, and we're going to try to have some leeway here on how you do that so that it's easy for you in your office. Most of our American cohorts participant chiros, they have their staff helping them with this, and then in Australia it's been mostly the chiropractors doing it, so you can have it work either way. It can be either the chiro or the staff, but the goal is that every 12 to 17-year-old patient is screened, because that allows for a consecutive invitation of eligible patients, which is a better study design and less bias and all those good things. And it's also really helpful for us too, because even if they're not eligible, it tells us who is in this chiropractor's office or why they're declining. Are they declining because it's not spinal pain, because it's going on longer than 6 weeks? Or are they declining because they didn't want to do it and questionnaires were too tough? Or they didn't like the text, that it was text format, whatever it is. That's really helpful for us. You can do the screening before their visit, either at the time of booking over the phone, or kind of pre-screening and calling the day before, morning of. And you can, put a note in there just for your communication within the office, especially if you have multiple staff, so they're not harassing people unduly. And then in the office, you can, if they're showing up on time, screen them in advance or on their way in. If none of that happened yet and you're in with your visit and realizing, hey, this is a teenager, then you can kind of screen them during their visit or directly afterwards. Really, you have some room to play here. And I'm going to go through the screen with you so that you can see how quick and easy it is. And so entering your name, we actually do in the US cohort have multiple chiros with the same last name, so you can enter your name in here, and then the patient initials. That just helps us keep track, especially when we have like an eligible patient, and then we can see that eligible patient went to do their consent form and baseline, or if they didn't, just based on those. The email is not required there. It does help the tracking. There's really or helped me follow up if they were eligible but didn't fill out their forms, and I can connect directly with them. But we didn't put it as required on there just in case they want their privacy extra protected, although it's not shared with anyone other than me. And I'm not going to email them if I don't need to. And then, are they in the right age range? This should always be yes, because that's kind of why you're screening them. And then, is this a new episode of spinal pain, neck, back, mid back, or low back? On here, you do have the option of choosing more than one, whether it's neck, mid back, or low back. But on the baseline questionnaires, you have to choose one primary. And so I'm going to choose neck pain for this one. Is it within the start within the new 6 weeks? So again, doesn't need to be a new patient, but it's a new episode of neck pain or spinal pain within the last 6 weeks. Are they at moderate to severe, meaning a 4 or above on our numeric rating scale? And was the current episode of neck pain preceded by a pain-free period? Right? They could have had neck pain in the past, but in the month before their visit, they did not have that problem. I'm going to put no for mid back and low back pain here, but it would basically pop up with all those same questions. Those are the eligibility criteria. And then an extra fine print eligibility criteria here. They need to be able to speak and read in English. Do they have their own phone that they can receive text message questionnaires on? And they're able to respond to those texts and email. And then we want to make sure it's not related to motor vehicle accident, workers' comp case, or serious pathology, meaning fracture, infection, cancer. You know, so there's no issues here about, there's no issues with if there's referral pains or if it's in conjunction with something else or if it's other types of trauma, that's all okay. And then is there any reason that you, as the person screening them, believe they shouldn't be included in the study? Also just making sure you're paying attention, not just saying yes, 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 and you're gonna hit a no. And you'll notice as soon as I hit this last yes, that it basically popped up with our link to the patient consent form, or a QR code did the same thing. So you can have them, you can click on the link and hand them a tablet if that's how you're doing it in your office. You can have them scan that QR code, which I also have in a PDF format that you can print out and have ready at your office, so that anytime they're eligible, you can just flip it over and have them do that. This isn't a link that's specific to them. The links that are specific to them happen after they sign a consent form. This one's a generic one. And then at the end, after you've had that conversation with them, you can ask, are they willing to participate? If yes, nothing changes. If you hit no, it'll ask you why. So we can have that detail in there. And then I want you to submit it, even if it's a no, right? Even if we had hit here and we're like, you know what, they actually weren't pain-free prior to this episode. There was something else going on before it. And then you'll notice that here it says, unfortunately, the patient's not eligible. Thank you for completing it, but please submit it anyway. So then you can make sure you do submit it. So we'll submit that for our purposes today. And that is it. That is the screener. Once you're familiar with the questions, it goes by really quickly. It takes me longer to read them than it will for your office to go through it. And so that is our inclusion exclusion criteria and how the screening process goes. If that screening process, or if they're excluded, you just go about your care, you say thanks. If they're included, then that's where we're going to send them an email. And just as like a few talking points that we're finding are working well in the office, at that initial bringing it up with your patients, the basic conversation usually goes something along the lines of, hi, our office is involved in a study on adolescent spinal pain, and it's on 12 to 17 years old. 12 to 17 year olds, and you are 12 to 17 years old. Do you mind if we screen to see if you're eligible to participate in the study or not? Most of the time people are like, yeah, sure. And they think it's really interesting that you're part of a study. And then if they are eligible, you say, oh, it looks like you are eligible here. And then talk to them about the study and what is included in it, which we have a slide coming on here. And then ask them if they want to participate. They want to participate, then obviously that's what you fill, that's where you're at the end of that screener. And you can either, if you're screening them before, you can even send them a link to the consent form and baseline prior to the study, or if it's at the time of or directly after your visit, that's totally okay too. However it works in your office, there is some leeway there as long as it's completed within 24 hours before or after that initial visit. And so when you're talking with your patients and their informed consent, you want to give them some information. And this information is all in the informed consent, but you probably will find it helpful to talk to the patient about it or have your staff trained up to do so. So the basic study design, as far as the patients are concerned, there's going to be 2 questionnaires, 3 months apart, one at the beginning, one at the end. And then each week in the middle, for 11 weeks, they'll get a really short text questionnaire. The questionnaires are going to take them probably between 5 and 20 minutes to complete, unless they read really slowly, and then maybe up to 30, but we haven't had anybody taking that long. And after they finish those questionnaires, the one at the beginning and the one at the end, they're going to get a $20 gift card to show our appreciation for their time. Make sure that the patient knows that there is no change in their care. There's no change in their care from their chiropractor and their relationship with their chiropractor or with Parker University or any of the other affiliated groups. But that they're allowed to decline and it won't negatively impact their care situation. And being involved in the study doesn't give them more care from you. It's just tracking. It doesn't change anything on that front. And there is space for both a parent and adult to sign, which we'll get, or parent and participant to sign, which we'll get to in a second. And then just if you do have a parent or adolescent who has extra questions, I do have copies of all of the questionnaires in PDF format on our shared Google resource folder. So if they want to see like, hey, what kind of questions are you asking my kid? You can show them exactly what questions we're asking their kids and go from there. And it's a good talking point as well, just to let them know who is texting them. It actually is a text from an automated system that is a secure research-based link in with our REDCap system, which is what our secure research questionnaires are from. So it's an auto send, but it is a very safe way of doing so. And they can always add it into their contact list once it's messaged them once, and just, because we don't want them talking to people who they don't know who they are, talking to people who are texting them, they don't know who they are. So it's a good, nice talking point on that. Although hopefully if these kids have cell phones, those have been conversations already. So when they first click on that link or scan the QR code, the first question that's going to come up even before their consent form is actually going to ask if the adolescent has decision-making power. 99% of the time, this should be a yes. Adolescents in Canada are allowed to make healthcare and research decisions on their own for themselves, as long as it is deemed that they understand the risks and benefits of doing so, that they understand exactly what it is that they're signing up for. And this is pretty straightforward. I think that they should be able to understand it. And so it's going to be a yes 99% of the time. If it's a no, it's very likely related to some intellectual impairment. So that can come up too. They can still participate in the study. It's just going to ask for both the parent and the adolescent to sign in those cases. And then in the questionnaires too, it will ask at the bottom, did anybody help them complete the questionnaire? And that will be a click yes if somebody helped them complete the questionnaires. We actually do know from other research that adolescents who are allowed to complete these forms by themselves are going to be more honest than if they have help from their parent. And we do get different answers even when parents rate themselves as knowing what's going on with their kids. So that's just something to keep in mind. And there is a place there for the parent to sign. And I do encourage you to have that conversation with the parent, even though they don't legally have to sign. If they're both in the room, involve them both, and then it's really a non-issue. Moving on for the adolescent baseline, like I said, take probably 10 to 20 minutes for them to complete. Most are in that 12 to 15 range. And it's going to ask them about how their pain is impacting their sleep, their studies, their sport participation, how they're coping with it. Just going to ask them a whole bunch of things, basically a bunch of validated outcome assessment tools that they've plugged in there all together. And with that patient baseline, oh, here's everything I just said. This is me cueing myself to remember to tell you all these things, and keeping in mind that their answers should reflect, oh, that says reflect their status prior to treatment, if you're completing it within 24 hours after their treatment. And there will be a place in there too for their consent form, on their consent form, to pick where they want their gift card from, because they've got about 20 choices of where it comes from. And there, if they've done their screening, they've signed their consent form, and they've completed their baseline, then your administrative staff is off the hook. They were helping you. That's the part you want them to help you with. From there, the adolescent is going to get text questions each week, and our chiros are going to be sent the baseline report, which is why we needed everybody's individual names on here. So this is going to ask a whole bunch of questions, and let's go over together so that you know exactly what it's going to ask you. So type in my little code here. These are all very much specific to each participant, so we do need to make sure we click on the right links for the right participants. For the most part, these will be sent to you in links that are from REDCap directly, but if for any reason you're not getting REDCap emails, then I'll send them to you directly with either an access code or a direct link, whichever works for you. So this is just a test patient that doesn't exist. And this is what a chiropractic baseline report looks like. So you get to pick which their reason was. And like I said, now it says select one, whereas in the screener, you could have selected multiple. It is going to ask if it radiates or not. If you click, I'm going to put no for here. Is it coexisting with anything else, right? So they've got low back pain, and maybe there's also pain in their abdomen. If you click other, it'll pop up to give you a spot to put that. How long ago was their pain? We know it should be less than 6 weeks because that was one of our eligibility criteria. And was it trauma, non-traumatic, or insidious? We don't know where it came from. And has the patient ever experienced this before? If yes, it's going to ask you how long ago. So this started like 2 years ago, and in those 2 years, they've had 3 episodes. Right? You can say whatever, or you can say unknown if you don't know, or if the patient doesn't know. They're like, yeah, I've had something similar to this before. You plug it in however it seems appropriate. And have they ever had chiro in the past for this before? Oh, it didn't like that I said that. Sorry. We need to not have extra words on that one. No, it says. So they've never had chiro. This is your first chiro experience for this imaginary patient. That is all of the details. It's going to ask you about their spinal pain. And then on our second page, it's going to ask you the results of the 2 orthopedic assessments that we're requesting that you complete. I have, and you saw it there, a copy of it, basically a paper or a PDF version of the Baton Hypermobility Scale that's in all the same order. So if you want to complete that in your office during your visit, then it'll be easier for you to plug this all in. But we're going to say that they have, what are we going to say? We're going to say they have right, neither, just make it easy for myself to score here. So they were a 2 out of 9. And you can put your 2. If you don't know how to do or score these things, I actually do have a YouTube video and link as well that will help you with that. And we're going to say that they were 4 centimeters away from the ground and that they had some stiffness but no pain. Noticing that we're reporting here in centimeters. And that's it. That's it for the chiro baseline. It will not take you very long. And we'll submit that one for our purposes. And then you'll get a little email that finishes. So this is a copy of just the PDF that I created. So you can have that in office. And then the fingertips to floor is pretty straightforward. But if you want a review of either, there are YouTube videos, and links are also in the chiro resource folder on our Google Drive. So for the next 3 months, you forget about the study, you treat them however you treat them, you discharge them, you refer them, you do whatever is most indicated for their case. And then at the end of those 3 months, the adolescent gets sent their baseline questionnaire and you get sent your final report. And so the final report for our chiros is going to be automatically sent to you through REDCap. And if it's not, then I will send it to you directly. It's shorter than your baseline, and it's going to be asking more about the treatment that you've provided. So let me show you what that one looks like. And again, these are all very specific to each patient. which is why we got to enter in those codes. But if you're following a link, you don't need to do that. I just have to do that because of how I had this set up. So wants to know how many weeks they were under care. So out of those 12-week period of the study, they were only under care for 6 in this imaginary situation, and we saw them 6 times in those 6 weeks. Their total cost was, we'll say, $500. Who knows? And here is where you can put, like, that's the total cost notice, regardless of who paid. But we could say that there was 400 of that was from insurance and 100 was out of pocket. You can include whatever details, or you could say they were sponsored through their sports team because you're their sports chiro, whatever it is, just whatever details you think are important, and whether or not you referred them for imaging. If you click yes, it's going to ask you what kind of imaging you did. And then here's our lovely little chart that is going to ask about different treatment choices. So if you did different types of manipulation and mobilization or soft tissue exercise, ergonomic instructions, whatever it is, and you get to choose, do you always do this? Frequently, often, occasionally, seldom, or never, roughly. This doesn't need to be perfect. It just gives us a gauge, kind of an idea of what kind of treatments are being offered. So we'll say if you always did soft tissue and you usually did high velocity adjusting, you never do any other kinds of adjusting. I'm just doing this quickly so that we can get through it. And because this is really it. Okay. If you hit something under other, it'll pop up to ask you what that other is. And then you submit. That's it. And you'll get a thank you from Dr. Pullman on that end. So once you've completed your final report, then we will send you a gift card for $50. And similarly to our adolescents, there's going to be a place in your consent form where you get to choose where you want that gift card to come from. And that's it for the chiro exit report. My job in all of this is basically to make your job and that those of your support staff as easy as possible. So I'm here to answer email or phone, whatever questions come up, and try to make everything work nice and easily for you. I also do have a resource folder prepared that has some posters you can put up in your office to let people know that you're involved in a study, which sometimes patients just like knowing that you're invested. I also have a poster that has the QR codes and links on it. That's really handy just to have up front so that you have quick access to the screeners and to the patient consent form and baseline. I'll have a couple videos for those orthos as well as this video on there. This questionnaire PDFs, all kinds of things. So I can just show you here as it pops up. Our Google Drive. And you don't even need to have a Google account to access the Google Drive. You just have to have the link that I send you. But that is all on there already. And that is it. We might send you occasional emails just to let you know how far along we are in the study, or if we find any relevant research we want to share, anything like that, or troubleshoot things that other people have had come up. And we keep going until we hit 45 patients. So thank you so much for your interest in the study or your participation in the study. And if you have any other friends, chiros, who you think would be good for the study and interested, you can always pass my information along to them as well. Thank you so much for your time, and let me know if anything comes up. Have a lovely day.